Hello, my name is Kevin Williams. I'm an admissions counselor here at Blessing Raymond College of Nursing and Health Sciences, and I'm here today to talk to you about our associate program in medical lab technology. Like I said, it is an associate program. It starts in the summer each year, and it's completed in 1 year. So you do come in with some prerequisite courses. Those can be taken at any accredited institution. We just transfer those credits in, and then you also maintain a 2.7 GPA. Once you transfer those credits, you start in the summer. It's summer, fall, spring, back-to-back semesters, and then you are done in 1 year. So like I said, start in May and then graduate the very next May, and then start working right away. So how do you apply to the program? We do have a paper application you complete, or you can also go online to our website and complete an application. So that website is www.brcn.edu. You click on Apply Now. Pretty simple process. There is no application fee, no essay or anything to write. You just simply fill out the application, fill out your information, and that gets sent to us. After the application process, we do require you submit your official transcripts, any college you've attended for those prerequisite courses, and then we can go ahead and get you accepted into the program. So the program does start in the summer each year. We do have rolling admissions, so you can apply anytime all the way up until classes start. So feel free to get on our website, apply. If you do have any questions about the program specifically, feel free to contact me. I can be reached at 217-228-5520, and my direct extension is 6958. Thank you.
Hi, my name is Lithila, and I am the MLT coordinator for Blessing Raymond College of Nursing and Health Sciences Medical Laboratory Technicians program. I've been with the college for about 1 year, but I've been with the Blessing Health System for over 20 years. And today we're just going to take a quick tour of the blood bank department and discuss some of the things we do here. This right here is our blood bank refrigerator, in which we store refrigerated products. An example of refrigerated products would include packed red blood cells. This is an example of a unit of packed red blood cells in which we would transfuse a patient who would have a low red cell count. Over here we have our blood bank freezer, where we store frozen products. An example of a frozen product is fresh frozen plasma. This is an example of a fresh frozen plasma. And this is actually stored for 12 months. And we would actually, before we would transfuse a patient with this, we would actually thaw this out in a 37-degree water bath. And over here is our platelet incubator, where we store platelets. And we store this at room temperature with constant agitation. This is an example of a unit of platelets. And this is usually transfused to a patient that has bleeding complications. And this is Carolyn Toki, who's one of our current MLT students that will be determining the blood type on one of her samples. In this procedure, Carolyn will be mixing patient sample with specific reagents to determine the patient's blood type. Now that the sample has been mixed with the reagent, we spin the sample down for 10 minutes. After the patient's sample has been spun down for 10 minutes, we have determined that the blood type is O positive. Welcome to our microbiology department, where we grow and identify bacteria and test them against certain antimicrobials. This has been one of our current medical laboratory technician students who will be performing an isolation procedure for you. In this procedure, Ben will be isolating out an organism using a 4-quadrant streaking method on a blood plate. After incubation for 24 hours, we have visible growth. In this procedure, Ben will now make a gram stain out of his culture. This is Alexis Williams, one of our current medical laboratory technician students. Now, after we have identified the organism as gram-positive cocci, Alexis will be performing biochemical testing to further confirm the organism. In this test, she is mixing this organism with hydrogen peroxide. This is known as the catalase test. In this procedure, Alexis will be doing the coagulase test. She will mix an isolate of the organism with reagent and check for a reaction. And she knows she has a positive reaction, so this organism is catalase positive, coagulase positive, identifying the organism as Staph aureus. This is Noelle Bruns. She's one of our current MLT students. Today she's going to show us how to make a blood slide in the hematology department. With this blood slide, we'll be able to visualize blood cells under a microscope. In this procedure, Noelle is going to make a wedge smear with a drop the patient sample and thin out the blood. Then she's going to stain it on a slide stain. Now that the slide is stained, we can visualize it under a microscope. This is Rosa. She's one of our current medical laboratory technician students, and she's going to identify the cells that was made by Noelle.
Okay, so these smaller round red cells right here are red blood cells. These bigger cells that are kind of pinkish purple, they're white blood cells. And then you have just these little tiny purple dots, those are platelets.
A medical laboratory technician is a healthcare professional who provides valuable laboratory results for physicians and nursing staff. Work as an MLT may largely be behind the scenes, however, we are a very patient-centered profession. Even with little patient contact, we have a large impact on patient care. An estimated 7% of patient care decisions is based on laboratory results. Hi guys, can you tell me what is unique about the MLT program at BRCN?
Well, the MLT program at BRCN is actually a quite small class, which gives us a benefit to have one-on-one help from our instructor. And then we actually became more of like a family. We actually help support each other, encourage each other, and just be there for each other.
MLT also has different clinical sites rather than just one, so you're able to see different hospital sizes, clinic sizes, all sorts of different environments in that way as well. So you can figure out what position you would preferably work in once you're done with the program.
So why should you choose a career in MLT?
If you want to be challenged every day, there's different types of work as a lab technician. Not every day is the same, and it definitely keeps your brain active. You're always constantly learning, and it keeps you on the move.
The field is definitely wide open. You can specialize in one department or the other. You can be a generalist. You can be a traveling tech. Your options are wide open as far as what you can do with the program after you're done.
Yeah, there's really a lot of variety. You learn something new every day. There's always something different happening.